Baptist Health Foundation provides financial resources and direct patient service resources every single day to patients and their families who find themselves in financially vulnerable positions.
The Baptist Health Foundation is how we're able to survive beyond our means here at the hospital. They want to be there to help those patients and customers that we have in need that can't help themselves. They're able to help us so that we can help our patients.
The patients come from all different walks of life.
Usually they're low income and their money that they do have has to go to just survival, rent, food. Your health is important, but if you don't know where you're sleeping, if you can't eat, those things have to come first. So whatever money you do have, they have to go to that first.
They're struggling each month to make it. And when they get sick, a lot of times the folks that don't have insurance come and wait till the very last minute, so they're very sick when they do come in.
And they don't have the resources to pay for like their prescriptions or the equipment medical equipment that they need to take care of their health.
As more and more social services have declined due to government funding, the nonprofit sector has been asked to step up further and further to bridge that gap. Baptist Health Foundation's Patient Assistance Fund exists to provide those financial resources for those patients who've been identified in our hospitals as being indigent or in need of financial care, who do not have the ability to care for themselves once they leave our hospitals.
They look at each person individually and their situation, and from there they decide if and how they can help them.
The Patient Assistance Fund, I really don't know what we would do sometimes if we didn't have that fund.
When the patient receives like the funds from the foundation, it's joy and relief that they feel, sometimes tears of joy. They're just very, very thankful, very grateful.
And part of our mission is to further the healing ministry of Christ. We're called, we're compelled. Your obligation on this earth is to take care of others, to love others the way Christ loved you, to care for others in their weakest moment, and to do for those who have the least. In the 3 years that the Patient Assistance Fund has been in existence, the need is growing greater and greater in the area of mental health diagnosis. And what we have recognized at the foundation is that there's this huge gap. Patients with mental health diagnosis who are living in a homeless shelter can't be discharged to a shelter if they don't come in with 30 days worth of medication.
So we've stabilized them, and we spent all this time doing therapy, stabilization, seeing the psychiatrist. But then when we discharge, they can't afford the medicines to continue, so it leaves them coming back.
And so what the foundation has been doing more and more is ensuring that that gap is covered, and we jump in immediately to make sure that whatever it is that they need after they leave the hospital to get well is taken care of.
It takes a burden off of us. Everybody that donates to this program really, really does make a difference. Even though if you can't see the person you're helping, just know I get to see them, and it makes a difference.
We are so blessed, and Jesus teaches us, to whom much is given, much is required. And this is our way of giving back by having that Patient Assistance Fund.
I know that we fill a void that no one else in town is filling. We are there right at the most crucial moment in people's lives, taking care of their very, very immediate needs. And we know we make a difference every single day.